Hello, my name is Daniel Schoonmaker. I'm the Executive Director of West Michigan Sustainable Business Forum and Michigan's Great Southwest Sustainable Business Forum, and I am pleased to welcome you to our presentation today. For those that are not familiar with our organization, the Sustainable Business Forum is a collaboration of businesses and institutions dedicated to promoting sustainable business practices with a focus on climate leadership, social justice, circular economy, and community resilience. This is part of a series of online discussions and topics centered around sustainability, sustainable business, climate, COVID impacts and recovery, equity, and prosperity. Our upcoming programs include how COVID-19 demonstrates the need for recycling and sustainable materials management, which will be next week, Wednesday, May 27th, again from noon to 1 p.m., featuring Tom Emmerich, CEO of Supan & Sons, Dar Boss, the Director of the Kent County Department of Public Works, Carrie Bliss of Padnos, and Michael Hodges of manufacturer Amcor. The following week, we'll have a discussion on how lake levels in COVID-19 will impact beach and river cleanups. Thinking about how we can get we can still serve and protect our local resources this summer. Featuring Tyrone Dobson of the Alliance for the Great Lakes, Brittany Good of Aldea Coffee, and Kathy Evans of the West Michigan Shoreline Regional Development Commission. Videos of today's program and the prior sessions are available on demand at no cost. You'll find a link to those in the chat shortly that you may like to bookmark. You'll also receive a link to those with the feedback survey and any additional notes that may come out of today's program this afternoon. This series and all of our programs are primarily funded through membership donations. If you are not yet a member of our organization, I encourage you to become one. There has never been a better time to do so or a greater need. To that effect, I'd like to recognize our newest professional members: Stephen Dahlquist, Amber Irish, Nicholas Neros, Ryan Gross, Emily Klott, Vivek Delela, and Jared Guys. For those who are interested in becoming an individual member of the organization, it is just $50 and free for students and employees of corporate or university members. You may also be interested in learning about our various working groups and committees, several of which are meeting in the next few weeks, including our Solid Waste Task Force on May 27th, our Michigan's Great Southwest Sustainable Business Forum Leadership Council, which I think is we have a few people on our panel today actually participating in, which is June 1, our Prosperous Economy Working Group, which will be meeting a few times over the next few weeks, and our Sustainability and Equity Working Group, which I'd imagine a number of people on the call today may take an interest in, which meets next on June 16th. Now, finally, I'd like to introduce my colleague, Chris Patrone, the Sustainable Business Forum's Equity Program Manager, who will be facilitating the conversation today. Chrissa?
Hi, everyone, and thank you for joining us today for this webinar on how Michigan's Great Southwest is advancing social equity and sustainability. I'm Carissa Patrone. I'm the Equity Program Manager for the West Michigan Sustainable Business Forum, and I am the one who leads our social justice initiatives, both internally and externally, with the goals of ensuring that sustainable business is inclusive and accessible for all, promoting the diversity of sustainable business, and also making sure that we're promoting a justice-centered model for sustainable business, which helps to leverage collective community resources to advance equity in the community. I also convene the Sustainability and Equity Working Group, which brings together folks from diverse backgrounds, from sustainable business, government, academia, et cetera, nonprofit organizations to improve racial and economic outcomes in West Michigan. And I would like to invite you all to join us if you'd like on Tuesday, June 16th from 1 to 2:30 p.m. And you can email me, I'll drop my email in the link in the chat box if you are interested in joining us. So today we'll hear from 3 local leaders who will discuss how we are working to elevate and address inclusion and equity in Southwest Michigan, predominantly in St. Joseph, Benton Harbor, and the greater Southwest Michigan community. So I would like to introduce Lynn Todman, the Executive Director for Population Health, Spectrum Health Lakeland, and also a City Commissioner for the City of St. Joseph. Laura Goos, who is Mayor Pro-Tem and Commissioner of the City of St. Joseph as well. And Mary Jo Schnell, who is the Executive Director for OutCenter of Southwest Michigan. So today we'll be talking about community leadership, improved business practices, and municipal policy to make sure that our Michigan's Great Southwest is the most sustainable and equitable place for all. So without further ado, I'll stop sharing my screen. And thank you all for joining us today. I really appreciate you being here to share your thoughts and perspectives with the audience. For our attendees, if you have any questions, you can use the question and answer function, or if you have anything to drop in the chat, feel free to do so as well. So before we get underway with some short presentations from you all, could you give me a brief introduction of yourselves and what brings you to the panel today?
Sure. I'll start. Again, my name is Lynn Todman, Executive Director for Population Health at Spectrum Health Lakeland. I also sit on the board of Edgewater Bank. And I think the best way to explain why I'm on the panel today is a story from when I was growing up on the south side of Chicago. My dad was a physician, very committed to serving that community. And one day we're driving and I see a man sleeping on the street underneath a viaduct. And I asked my father, I was very young, I said, why is he doing that? And he said, he probably doesn't have a place to sleep. And it was at that moment when I realized that actually happens. I was a young kid. And then I asked him, what's gonna happen to him in the winter? And he said, very matter-of-factly, he'll probably die. And it was, you know, looking back on it, that's when I realized, you know, I didn't have the fancy words for it at the time, but social conditions make a difference to your health, and that social conditions actually contribute to health disparities. So since a young child, I've been very committed to concern about social justice issues around equity. And so this panel fits right in with my life's work.
Thanks for sharing.
Mm-hmm.
So I'll go next. I'm Laura Goos, as Carissa mentioned. I am a city commissioner along with my colleague, Dr. Todman, on the city commission for the city of St. Joseph. I also work at Whirlpool Corporation and have been there for 15 years. What I bring to the panel is, you know, as Lynn said, a shared passion around social equity. I bring a slightly different perspective to that because I incorporate the work that I do for the city of St. Joseph and have done in my career as a human resources professional. I bring that lens to sustainability work, and I'll talk a little bit about that. But this pandemic, you may think, what does this have to do with sustainability? But it's all about our public health, our environmental impact, and social equity has never been more clearly needed than what this pandemic has brought out in all of those areas. So I'm very excited to hear what my fellow panelists say and entertain any questions from the audience as well.
Thank you. Mary, would you like to share a little bit about yourself?
Sure. My name's Mary Jo Schnell. I'm the Executive Director of the OutCenter of Southwest Michigan. We serve Van Buren, Berrien, and Cass counties. I'll tell more about the organization when it's my time up, but what brings me to this panel and to this amazing forum that I didn't know about is because I think sustainability has everything to do about change. And I think now more than ever, a lot of folks are working around those topics. We have a new operating reality, a lot of online stuff. How does that function really when we've got a digital divide? So the idea of sustainability and change, I think, are entwined. I'm happy about that. What brings me to this is because of my commitment, because I'm my mother's daughter. And she shared with her kids over and over, not only by word, but by actual demonstration, about caring for each other, about social equity, even though those weren't words she had in her lifetime. But I'm just pleased to be here, grateful for the opportunity, and grateful to be on this panel with these two amazing women. So I'm just grateful.
Thank you for sharing. And I'm really looking forward into starting this conversation with you all today. I'll start sharing my screen again. And we've seen how within the past few months, historically under-resourced communities have been experiencing disproportionate impacts from this pandemic, which have only been amplified during this time, all of the systemic inequities and historical inequities within our community. So I really appreciate you for all being here today to share your perspectives and how you are working to tackle these inequities, not only today, but also tomorrow, to advance social justice in Southwest Michigan. So Lynn, if you would be able to share a little bit about what you focus on first, that would be really great.
Thank you, Carissa. So a little bit more context. So I'm trained as an urban planner, but for the last 15 years, I've worked in healthcare, where I'm working really, really hard to change perspectives and narratives on what determines health, including mental health, and what determines health disparities. I'm particularly committed to working to help people understand how structural forces, both historical and contemporary, have created these conditions that cause health inequities. Too often we hear people blame people for being sick and dying, when the causes are far more complex and often obscured. So my work, the work that I do, is really designed to help people understand how these larger, often invisible forces distribute the risk for illness and early death in ways that are systematic, they're perennial, and they do it in ways that constantly, decade over decade, advantage some groups and disadvantage others. So that is fundamentally the work that I do. A great example, I think sometimes we throw terms like systems and structures around without fully unpacking it for people for whom this may be new. So I'll just give you an example of the kinds of narrative shifts that I'm working on to advance issues around equity, health equity, social equity, all forms of equity. And a great example is the use of housing in this country. Has both historical and contemporary features that disadvantage people in ways that harm their health. And so we know, for instance, there was a federal law almost 100 years ago in the 1930s that limited mortgages to and other kinds of capital to Black people, which limited access to home ownership, which has been the major wealth generator in this country. And we know that health is linked to wealth. The law evolved into a less formal organizational practice that's still being used by banks. It's called redlining, to limit access, that limits access to capital investments in Black and brown communities. And that lack of investment over decades has left these communities with many of the resources they need to be healthy. So quality housing and jobs and food and transportation. And that lack of investment over decades has created these profound disparities in health that we see all the time and that are amplified in times like COVID. And so here is a slide that shows the COVID figures for Marion County right now. In the red, we see the percentage of Black and white people in this county, 78% white, 15% Black. But you look at the COVID cases, and the percentages shift significantly and highlights important disparities. So of the COVID cases, only 55% of them are white, 35% are Black. So twice, Blacks are represented at more than twice the rate of COVID cases. You see a similar disparity in hospitalizations. 43% of the hospitalizations are Black. Despite the fact that Blacks are only 15% of the population, you see the same thing in COVID deaths, these disparities. So my work, again, is really designed to help people to look beneath these numbers to understand what's driving them. It is not simply people's, I say in quotes, bad behavior. People behave in ways that the context in which they're living in or working in drive them to act. And then, you know, I remember talking to a healthcare executive in early February when we were just beginning to hear about COVID. And I shared with this executive that my concern was an anticipated, what we say in health, a social gradient in the incidence of this disease. And I was pretty surprised that the executive didn't understand what I meant. And what I actually meant is that it was really predictable that these numbers would look like this the way they do. It was really predictable that there would be a disproportionately high burden on people at the lower end of the socioeconomic ladder. Every epidemic and pandemic, from the Black Death in 14th century Europe to the flu pandemic of last century to the HIV/AIDS epidemic, disproportionately impacts the people who are most socially and economically disadvantaged. Well, it's not surprising. And if you go to my next slide, I can kind of unpack how that happens. Oh, I don't know if you guys can see it. It's really, really small. But essentially, what it says is that community disinvestment on the far right side, so limited access to financing and a shrinking tax base, leads to a decrease in access to resources and opportunities that we need for good health, like food, jobs, homes, education, and transportation, which leads to this chronic level of psychological distress that people experience when they don't have access to these resources for long periods of time. We now know that those high levels of stress, the prolonged lingering of stress hormones in the body is causally linked to things like cardiovascular disease, hypertension, diabetes, obesity. And we now know that these things increase the risk for COVID illness. Not only do they increase the risk for COVID illness, but it's compounded on the fact that many of these individuals live in communities that have few of the resources that allow them to comply with public health guidance. And they're also more likely to be working in so-called essential jobs. So in a nutshell, this is the work that I do, is really trying to reframe the narrative around why health inequities exist and link them to the social and economic inequities that are systematically structured by public policy, legislation, and social norms that we have in this country. So that's my work in a nutshell.
Thank you, Lynn, for sharing all of that information, and especially on the work that you do in reframing these situations and these inequities in our community. I really appreciate that. Mm-hmm. Next, I would like to invite Laura to speak a little bit about the process and creation of the new City of St. Joseph Non-Discrimination Ordinance and how it will impact municipal service and potential outcomes.
Thanks, and I want to thank Lynn too. That was really fantastic, and it really does lead into what I'm going to talk about in terms of what we do with the City of St. Joseph, specifically around social equity and sustainability. These things, we do have a new non-discrimination ordinance. A lot of the care and desire for these types of things, though, have been within the city for a while, and new commissioners like myself and Lynn and Peggy Getty are simply taking the opportunity to repackage and grow some of the desire and intent that may have been with the city long term. So we're capitalizing and building on a structure that was built before us. So if you want to advance to the next slide, we created a sustainability committee, and I am going to talk about the non-discrimination ordinance, but it's important to see the building blocks of how we got there. Sustainability for the city of St. Joseph means a couple of different things. We have a vision within our sustainability team, our committee, to meet the social, environmental, and economic needs of the people of St. Joseph without compromising the ability of future generations to meet their own needs and to leave our community as good as, if not better than, the one we found. Now, that's not an environmental statement, right? That's a vision that is about sustainability. It's about building something for the future. So I think you can advance, and you'll see how our team builds on this. So our areas of focus, yes, we do look at traditional sustainability things. You know, we want to have renewable energy. We want to reduce our reliance on fossil fuels. We are investing in better fuel standards for our transportation. We just bought a couple of new hybrid public safety cars and 2 more next year. And we're looking at resource management. How do we take care of our water, our sanitation, our sewers? How do we account for parks and open space? These are all big things, all interlaced in our city's master plan. And then the final piece is what I'm really going to talk about today, which is our community engagement. Not only do we want to create a sustainable, walkable, and livable community, we want to promote inclusion. We are developing a green infrastructure approach, and we're documenting affordable and/or green housing. So our approach to sustainability is really threefold. It's environmental, it's financial, and it's social. And I took a quote here from Catherine Takai, which just basically outlines that this approach has to include social equity, which refers to fair access and resources and opportunities for full participation in the social and cultural life of a community. And that is essential for moving forward into the future. So I think that really speaks to our sustainability plan and our sustainability committee. And so if you want to go to the next slide, this is where I talk a bit about the non-discrimination ordinance. We actually adopted the non-discrimination ordinance in March of 2019. And that non-discrimination ordinance, as part of our sustainability plan, helps to try to fill a local gap in our state legislature. So we have the Elliott-Larsen Civil Rights Act, but there is a glaring hole there when it comes to LGBTQ plus community members. So we developed, along with many other communities in the state of Michigan, I think we were number 46 to adopt such a measure, where we are inputting the LGBTQ community in our protected classes for civil rights. And we also then in 2020, in fact, just earlier this month, adopted a resolution in support of amending the Elliott-Larsen Civil Rights Act to include protections that our non-discrimination ordinance already does. So we have put our stamp of approval on a measure that hopefully will be coming to the ballot this November for the citizens of Michigan to vote upon, to amend what we feel is a glaring hole in this Elliott-Larsen Civil Rights Act. And I want to build upon what Lynn said in terms of why this is important for our community. I mean, when we talk about social disparity, and we focus in our sustainability team specifically on trying to promote inclusion in this particular lever for our sustainability team, we look for ways that we can talk about affordable housing as an example. Affordable and green housing is one of the levers that we want to document and hopefully influence in the future. When you think about what Dr. Todman talked about, how does that relate to public health? Well, if you have affordable housing and you feel secure in that space, then if you follow Maslow's hierarchy of needs, you can then think about other things. You can think about access to health care. You can think about taking care of yourself through exercise and expanding on those parks and open spaces that we have as part of sustainability. Because we know that people who are not able to have the same access to health care and to wellness activities are at risk for things like COVID-19 at a greater rate, which, as Lynn said, unfortunately, disproportionately affects people of color, for instance, but also, although I don't have stats for this, I would say other at-risk communities like our LGBTQ plus youth who may be displaced from their homes because of being part of the community for the LGBTQ plus group. And so those are things that I think put us at risk. And that is why, as a city and as a community in Southwest Michigan, we need to look for ways to include social equity in everything that we're doing. So that is kind of the non-discrimination ordinance and sustainability for us in a very brief nutshell.
Thank you for sharing, Lynn. That's great. It was a great overview of what the City of St. Joseph is really doing, not only in regards to social equity, but around the triple bottom line altogether, with consideration in the environmental space, social equity, and economic as well. So without further ado, I would like to invite Mary Jo to speak a little bit about her work at the OutCenter and talk a little bit about how businesses and entities, individuals can help to really stand alongside the LGBTQ plus community and advance social equity within the workplace in regards to more equitable and inclusive policies and practices.
Thank you, Carissa, and thank you, Laura and Lynn. As a larger frame to the conversation about equity for LGBTQ people, I also want us to be cognizant of intersectional identities. So people who are have identities that are made up of multiple components that are all marginalized, right? So imagine if you're LGBTQ in a state that doesn't protect you. Now imagine that you're a person of color. Now imagine that you're a person of color, LGBTQ, and you have a disability. So these are really critical things to understand in terms of intersectional identity and how that puts more people more at risk, unfortunately. I will say to Laura's earlier comment, there is no statewide, hold on, sorry, there is no federal or state act or law that specifically protects LGBTQ people from discrimination in housing and employment and public accommodation and services, you name it. And we've seen an uptick in hate crimes against all marginalized groups since 2016, as documented by the FBI. Changes come from the bottom up, not the top down. Power is indeed with the people. It's important also for everybody to understand the work that's going around you here in Southwest Michigan, just so you know that there's a lot of heavy lifting going on by a lot of folks. And that's impacting you, your families, your employees, their families, your clients and customers. As Laura Goos shared, we helped put the first NDO in place in our service area in St. Joe, which is the seat of Berrien County. This is Ida, who's, I guess, hungry right now. And that we are also talking with other municipalities who want to replicate this initiative or that initiative. We're also working with the LGBTQ, we are the LGBTQ Safe Schools Collaborative, funded in part by United Way of Southwest Michigan. I am name dropping because that's important, right? We're working with 16 schools, primarily in small towns. This is important stuff because these schools are hubs of so much networking. So we say we follow the kids' story into their family, saving their lives and family relationships, and into their school communities, providing workshops, best practices, leveraging State Board of Ed, phenomenal work by the State Board of Ed. In these small somewhat closed and conservative communities. We are hitting some roadblocks, but going high and ultimately overcoming them. So I just want you to know that that's going on in Bridgman. We helped the first trans girl to get on the girls' dive team, right? There's a lot of impact going on around you. We, of course, serve the Tri-County area, and we also leverage information, resources, and opportunities from a statewide network of LGBT centers and a national network of 250 LGBT centers. So we're getting information from LA, from New York, from Chicago, as well as, right? And able to do a lot with that. We also have a workshop for area businesses because we know that businesses are also important hubs in small town communities. It is led by Caroline Jones, who centers her approach around the values of each business, customer service, benefits of inclusion, and uses risk communication practices to address workplace issues of concern. The workshop is for employees, and also addresses issues that arise from customers. It's more inclusive, translates into more competitive advantage in terms of raising the business's cultural competency to whoever comes through the door. But also more talent available because you're dealing with a bigger pool. I will say the new operating reality for us in terms of COVID, LGBT people are very much concerned about this. We do not trust healthcare. We don't have the grounds or the experiences to trust healthcare. That trust was lost a long time ago, but it was even compounded during HIV/AIDS. The LGBT population is more at risk in terms of its use of tobacco, 50% higher than the general population, which is a respiratory illness creating that vulnerability. The population has higher rates of HIV and cancer, which means a greater number of us may have compromised immune systems. And we continue to experience discrimination, unwelcoming attitudes, and lack of understanding from providers and staff in healthcare settings. In addition, there are more than 3 million LGBT older people living in the United States, and the elders are already less likely than their heterosexual and cisgender peers to reach out to healthy and aging, aging providers like senior centers and meal programs. So there's a lot of things that we've been doing in response to this. Locally, we've been working with funders. The emergency fund and aid, we're hoping, and we've got some assurance that they will make sure that the charities that are getting funding aren't going to discriminate or turn LGBTQ people away from their pantries, as has been done in the past in our area. We also worked with a very large healthcare provider just last week, where policies are now changing to really specifically protect LGBT people from discrimination. So we're doing a lot of work before this, and then of course, in addition to this, it's amped up for us. I think I've never been busier in my life. We have moved online. We never missed a beat. We lost 2 programs that couldn't go online, but get this, in terms of sustainability, we are now offering online programs from other LGBT centers in the state of Michigan up by Detroit. They share the Zoom information with us. We put it on our program calendars, and for the first time ever, think about AA. Think about folks who are struggling with addiction right now. We have, I think, 5 new programs for LGBT folks, for meth addiction, for prescription drug addiction. I mean, it's just amazing what's happening online right now. And I cannot say, turn this back over without saying, please, folks, if you have it in your power to donate to the OutCenter, OutCenter.org. We're in need of support right now more than ever. So thanks. That's my presentation, and I'll pass it back to you, Carissa.
Thank you, Mary Jo, for sharing all of the work that you're doing and all of those intersectionalities. I think that's very important to highlight throughout this pandemic, not only throughout today's crisis, but moving forward as well. Those are all things that we need to consider when not only addressing these issues, but creating better programs and being able to better include folks in our workplace. So I'd like to thank you all for sharing a little bit about the work that you do. And although your programs and projects or initiatives might look a little bit different, there is that great commonality between all the work in which you do in advancing social equity. So the true triple bottom line of sustainability really focuses on, as Laura had mentioned, not only economics and not only environment, but really social equity as well. So those kind of three pillars make up sustainability as a whole. So I was wondering, in regards to that and in regards to sustainability and making sure that practices and policies are more holistic and inclusive and long-term, which are all kind of facets of sustainability in general, how would you say that your work really focuses on bringing those two pieces together, social equity and sustainability as a whole? And I'd invite any of you to answer this question if you'd like.
I have more of an observation than an answer to that question around the importance of this work. And I spend a lot of my time looking at data about this county. And one of the things that has been standing out for so long is the brain drain. We lose people and people, and that's damaging for a region, and we continue to lose people, and the demographic is getting older. And I'm going to go out on a limb to say that if we don't get this right, we will continue to see this trend happen. You know, people want to move to communities that they can feel a part of, that they can feel that they have a fair and equitable shot at decent housing, food, employment, leisure activities, the ability to walk down the street and feel safe. And if we don't get this social equity thing right, it's going to compromise the long-term sustainability of this community. And I can say personally that I've known a number of people that we would have liked to have stayed in this community, but because they have not felt included and embraced and have not felt that they got a fair shot at opportunities, have left. And so I just want to punctuate the bigger picture here that this is not a feel-good thing. This is about the sustainability of our region and the growth, the economic growth of our region as well. So that didn't directly answer your question, and I can answer the question, but I'd rather kind of loop it back to my colleagues on the panel, and if there's time, I can actually answer your question. But I wanted to make that point.
Yeah, that's great. Thanks for sharing.
Yeah, and I couldn't agree more. As you know, Lynn, in my day job, I actually work in human resources for Whirlpool Corporation. And my job really is to attract people to Whirlpool. So I'm in talent acquisition, and as a major employer here in town, pandemic aside, of course, when we are trying to recruit people here, we have to have a welcoming and inclusive environment for people who would be moving from Baltimore or Seattle or Italy or Brazil to come here and look at our small dot on the map, very rural area surrounded by farmlands where they've lived in high rises. We have to have something different and have a differential that will attract people to move here, buy a home here, send their kids to school here, which is funding for the school systems, buy groceries, shop retail, go to the barber, whatever. They would be spending their dollars here versus taking a job with another company elsewhere. So to Lynn's point, we have to get this right. And we have to be inclusive of different cultures, of different people of all walks of life, different religions, different, inclusive of political views, inclusive of, educational views, all of it. And without that piece, if we cannot separate those two. Sustainability is so much about looking to the future and what we're doing to make the future brighter and better, that if we don't get it right now, there will be dark days ahead. and we don't want that. So we continually have that conversation in the City of St. Joseph Commission whenever there's an opportunity for us to talk about those types of things, whether that's we're putting it on the agenda or having a study session about it, or in the case of the Non-Discrimination Ordinance, being able to make a statement to our community, our state, and our little map dot that we care and that we want all of our residents and all of our guests to feel welcome and to feel part of it, then we try to do that.
And I absolutely everything that what Lynn and Laura said. I think from my perspective, what I see is just, you know, at what point does somebody like me or an African-American out lesbian feels like she can walk down any street, oh my gosh, right? And feel like she belongs, right? Now she's holding hands with her partner and she's walking down that street, right? We have a lot of work to do. We have a lot of education to do. I also wanted to raise the idea about the second home owners and tourism, because I know when we were talking about the NDO and doing the presentations to the commissioners, we were also saying, at what point do people come visit if they don't feel they can hold hands and walk down the streets of St. Joe? I can't tell you how many conversations I've had with people who have actually left because of the looks they got, a gay couple, right, in St. Joe. And in terms of brain drain, for LGBTQ people, I worry like heck about transition, you know, leadership transition, because, you know, the last round that we did trying to attract top talent, when they get here and then they're like, oh, wait, I have to live, wait, really? No, right? And then we also have, you know, I can't tell you how many friends that African-American friends that went to Benton Harbor High School, but the minute they graduated, they were out like a shot. So, and in part it's being denied employment, and they're not sure at this point, is it because of my skin color or because of my sexual orientation or my gender identity? So a lot of work to do. We're excited to do that work. We need funding to do that work now more than ever. Did I mention about donations? But it's good work to be doing, and it's this most excellent moment for us to care about each other in such exquisite ways that we make this community the community we want to belong to.
Yeah.
Off my soapbox.
So Carissa, I can take a shot at your actual question, unless you want to take questions. How do you want to go?
Sure, you can expand on that.
So, you know, you ask like how, you know, we're addressing equity in our work, how I work for you. So in my case, there are a couple of things. So in community health, what I have done in the last couple of years is try and give real primacy in the work to those parts of our community that are hurting the most. So that means doing a good deal of our work in neighborhoods where we know the life expectancy is low and the mortality rates are high, and really focusing, you know, on the needs of those areas. Some will know community grand rounds, a speaker dialogue series that we've hosted to really start shifting this narrative about why people get sick, and, you know, stop blaming people for sicknesses that are caused by environmental factors. Out of that grew Brave Talks, when we realized people had a hard time talking about racism, you know, and I've shared with my colleagues we're going to start talking about classism soon too, because these things are real, and they contribute to all kinds of social and economic disparities that show up in health. I'm all about shifting the narrative, so I write editorials, I do radio spots, speaking engagements, keynotes, anywhere I can start kind of reframing the narrative on what shapes health, why people get sick. I'm pretty hopeful about what's happening at Lakeland Spectrum for, you know, we have some priorities that are emerging that are, you know, kind of calling out health equity and disparities, and kind of acknowledging that social conditions shape health, not bad people and bad behaviors. So I feel hopeful about the things that are happening in the health space. But those are just examples of how themes of social justice and equity show up in my work.
Yeah, thank you for sharing that.
And I'll just expand on, I mean, I talked a lot about what I do with the commission and the city, but from I mentioned that I do talent acquisition. You know, Whirlpool being a Fortune 500 company, we're global, so we interact with people every day in, you know, different parts of the world from different backgrounds. And you do feel sometimes like you're in a bit of a bubble. And when you leave work and you recognize that there are disparities within our own community, the differences and the unintended segregation between St. Joseph and Benton Harbor, as an example, those are things that smack you in the face. And so I try to balance that with my city commission work and my work at Whirlpool, because I do feel like I'm in a little bit of an insular bubble sometimes at Whirlpool. And then I come home and we have to every day make sure that we're, as Lynn said, talking about racism, talking about classism, and trying to fight against that. One of the things from a Whirlpool perspective, I'm very involved with our inclusion and diversity work, fighting unconscious bias in hiring practices, because every person, no matter who you are, has bias built in. It may be that you know, you prefer to, you know, talk to somebody that looks like you, but it may be that you like somebody's accent because it's the same as yours, so you feel a connection. Or maybe you have a connection because you have a religious background the same, or whatever. Those unconscious biases come into play and you feel more at home with somebody, and all of a sudden that bias has been realized and you're hiring somebody just like you, and it perpetuates, right? And so we train hiring managers and we train recruiters to recognize that and to fight against that. On the other hand, on the other part of my life, when it comes to the city piece of it, again, we have to look at challenging those biases that have been there for so long, unconscious though they may be, and try to have those tougher conversations, and allow people to have the room to bring them up, and to know that their concerns will be met with concern and a positive intention. So those are just a couple of things I wanted to add in there as well, is because it is a very complex space. And you know, I look at one thing from my employer and then another from my city commission life, and it's a very complex space for us to be in.
Thank you for sharing. And some of these questions that are being answered are coming from the question and answer chat function. So thank you for addressing some of those questions that have been coming in kind of in the meantime. So I'd like to recognize a lot of your thoughtful answers, and that a lot of the inequities that we're seeing are both systemic and historical. So they've been embedded in our communities, and those need to be continuously addressed in order to really create a more prosperous future for all peoples, really addressing segregation, addressing inequities between communities that share a lot of things. So now that we've learned a little bit more about the work that you all are doing to really advance equity within your communities and our work, could you share some quick ways in which businesses or individuals, institutions can really contribute to advancing social equity in our communities? What are some things that we might be able to do moving forward, whether it's replicating some of these initiatives in other communities or getting involved in the work that you all are doing here.
I mean, I think just, you know, I consider myself a newcomer to the community because I wasn't born here. But one of the things I observe is people just this discomfort with talking about these things. I think one of the things that needs to happen is people need to start talking to colleagues, to friends, to relatives about some of these issues of inequities. I think those of us who aren't on the short stick of those inequities, it's very convenient to not talk about it. But I think we have to develop a discipline because we all often see it. I think we have to develop a discipline to actually call it out when we see it. And it's uncomfortable and it's stressful. But I think the only way we're actually gonna make progress is for people to actually make these issues part of their dialogue. I think obviously things we have to do, but I think we do need to start talking explicitly about these things more.
Absolutely, I couldn't agree more. And it's tough. This is tough stuff because people, it makes people uncomfortable. It makes us all uncomfortable. I've seen a couple of comments about particularly the racial disparity in our community, and it's there. I mean, we know it's there, and we need to talk about it. I think that as community leaders, we need to help people talk about it and challenge some of the notions that it's not okay to name the elephant in the room and just to ignore it. But I think we have to take those brave first steps. I think conversations like this help. I think that having larger community forums help. Lynn and I were fortunate to be part of a intergovernmental meeting. Was that earlier this year or late last year?
I think it was late last year.
It's so,
yeah.
The year has changed my concept of time. But I felt so fortunate to be part of this group that met. It was the county commissioners,
St. Joe.
I'm sorry, that they were facilitating. It wasn't the county.
Right.
It was St. Joe Township, City of St. Joseph, and City of Benton Harbor.
Right.
Yeah. And we were fortunate enough to get together, but that doesn't happen. I mean, that according to our longer term commissioners, that was a rarity. Maybe once every 20 years or so. We need to have more of those forums and have also the public involved in those discussions so that we can have open dialogues with each other and challenge the status quo, if you will. And I think that's how we start to address some of these issues and heal as a community.
I also want to speak to a question in the chat that somebody asked about St. Joseph's image of not being particularly friendly to outsiders, and acknowledge that that is a thing. Part of our decision to pass the ordinance was a signal that we do want to see change as commissioners in the city. There are other things we're talking about to kind of to push this idea that St. Joe push the idea that it's an inclusive community. And to be honest, and speaking of like the obvious, I'm African-American, I'm on the city commission. That would not have happened, I don't know, 5 years ago, 10 years ago. So I see some progress there. I'm not underestimating the road that we have left to go, but it is an active theme of conversation amongst the city commission. Know that.
And I'd like to also say that the way forward, educate, right? Get familiar, get comfortable, right? Through education. There's grand rounds going on. There are workshops. There are The OutCenter has a couple of different versions of our workshop. We do workshops in school communities. We do workshops with healthcare providers. We do workshops with businesses. I think Morse Hospitality Group, we did that last year with their team. And so there are really great ways to start with systems change by just getting educated. And then committing to those best practices that you're introduced to. And every day in your workplace, think about these things, talk about these things. The more we are, I'll say, vulnerable to each other, I think the better. The more we are caring about each other, of course, the better. So absolutely, that's our way forward. We've had a lot of success, I'll just say it that way. And again, to Lynn's point, wouldn't have happened 5 years ago. Wouldn't have happened 10 years ago. So my 2 cents.
And I'm, as a selfish fellow commissioner, I couldn't be happier that I get to work closely with such an amazing person. And the other thing I wanted to say too is that, just to echo what the other 2 panelists have been saying, is we have to lift each other's voices up and make room in conversations for each other, and just to be, Mary Jo, I think saying, you know, we have to be vulnerable with each other. I think that's a huge piece of it, right? I mean, just allowing yourself to be vulnerable. Stop. Yeah.
And to make mistakes, to say the wrong thing.
I say the wrong thing.
To mess that up. You know, it takes vulnerability and extending grace, because we're not going to get it right the first time. You know, it's gonna, you know, no one taught us how to do this, right? No one, if this were like packageable, and we would have figured this out. So, yeah. I'm just looking at the questions here.
Yeah, there's a lot of questions that we have left kind of unanswered, and we just have a few minutes left, but if possible, I would like to pass those questions along to our panelists, and then if they're able to answer those questions, I can send those out in a document to all of our attendees today, so that we can have more actionable items of how folks can get engaged, along with some more information about what the county and city are doing in regards to making sure that this is a more equitable and inclusive place to live. So I'd like to thank you all for sharing a lot of your questions and answering all of those questions. And I'll definitely send a follow-up email with you all.
Great.
So kind of to wrap up today, I would like to thank you, Lynn, Laura, and Mary Jo, for sharing all the work that you do in our community to elevate voices and advance equity within our communities, and also taking the time to really talk about these pressing issues. And I hope that this conversation continues as we work all together for the collaboration of the collective good. So if you all found our conversation valuable today, I would like to invite you to become a WMSBF member and check out our website for more updates on upcoming webinars that you could all participate in, and other opportunities, as well as our working group information, etc. So please look out for an email with me for a post webinar survey, and then along with some of the questions and answers that I will invite our panelists to look at after this session. And then we hope that you could join us next week for our webinar on May 27th from 12 to 1 on recycling and sustainable materials management. As said before, with the folks from Shupian, the Kent County Department of Public Works, PADNOS, and AMCOR. And I would like to thank you all for joining us, and I really appreciate all of you panelists for being vulnerable, sharing your stories and perspectives, and really helping to advance equity within our community. And with that, I would like you all to have a good rest of your day and take care.
Thank you
so much for this great opportunity.
Everybody.
Have a great day.
Bye.
Peace and love.